Hello and welcome back to The Rational Brit. Today we're tackling one of the most pressing questions facing Britain. What does the future hold for our National Health Service? Is the NHS facing an insurmountable crisis, or are we on the cusp of transformative innovation that could secure its future for generations to come? The NHS is more than just a healthcare system. Since its founding in 1948, it has become a cornerstone of British identity, a source of national pride, and for many, the closest thing we have to a secular religion. But in recent years, the headlines have been dominated by stories of overwhelming pressures, chronic underfunding, and a system seemingly at breaking point. Today we'll examine both sides of this crucial debate with clear-eyed analysis, looking at the very real challenges the NHS faces, whilst also exploring the innovative solutions and technological advances that could transform healthcare delivery in Britain. Let's dive in. Let's begin with the uncomfortable truths. The NHS is undeniably under immense pressure, and dismissing these challenges would neither be rational nor helpful. First, the waiting lists. As of recent data, over 7 million people are waiting for hospital treatment in England alone. That's roughly 1 in 8 people. Some patients are waiting over 18 months for routine procedures that significantly impact their quality of life. During the winter months, accident and emergency departments routinely see 12-hour waits, with some patients spending days on trolleys in corridors. This isn't healthcare as we imagine it should be. Second, we must confront the funding reality. While spending on the NHS has increased in absolute terms, the rate of growth has been significantly lower than the historical average. Between 1950 and 2020, NHS spending grew by an average of 3.7% per year in real terms. However, between 2010 and 2020, that growth slowed to just 1.5% annually. Meanwhile, demand has exploded. An aging population, increasing rates of chronic conditions like diabetes and dementia, and the rising costs of new medical technologies all place additional strain on the system. Third, the workforce crisis cannot be ignored. The NHS is facing severe staffing shortages across almost every category. We're short approximately 40,000 nurses and over 8,000 doctors. Staff burnout is at epidemic levels, with surveys showing that over 40% of NHS staff report feeling unwell due to work-related stress. The pandemic exacerbated these issues dramatically, pushing many experienced healthcare workers to early retirement or out of the profession entirely. Fourth, infrastructure decay is a hidden but critical problem. Many NHS hospitals are operating in buildings that are decades old, some dating back to the Victorian era. We've seen tragic incidents where ceiling collapses and infrastructure failures have forced the evacuation of entire wards. The maintenance backlog is estimated at over £10 billion, and this figure grows every year. Fifth, there's a productivity puzzle. Despite technological advances that should improve efficiency, the NHS productivity has actually declined in recent years. Studies suggest that the NHS is less productive than comparable healthcare systems in other developed nations. Some of this relates to outdated IT systems that don't communicate with each other, creating inefficiencies and duplicated work. Administrative burdens consume time that clinical staff could spend with patients. And finally, we must acknowledge the growing health inequalities. Life expectancy in the most deprived areas of Britain is nearly 10 years lower than in the most affluent areas. Access to specialist services varies dramatically depending on postcode. These inequalities have widened in recent years, representing a fundamental failure of the founding principle that healthcare should be available to all, regardless of wealth or location. These challenges are real, substantial, and urgent. They represent a genuine crisis that demands serious attention. But here's where we need to apply some rational thinking. Acknowledging a crisis doesn't mean accepting defeat. In fact, crisis often catalyzes innovation. Now let's turn to the more optimistic part of our analysis, because there are genuinely exciting developments that could transform NHS healthcare delivery. First, artificial intelligence and machine learning are already showing remarkable potential. AI systems are now capable of detecting certain cancers from scans more accurately than human radiologists. Algorithms can predict which patients are at highest risk of deterioration, allowing preventative interventions. AI-powered chatbots and triage systems could handle routine queries, freeing up clinician time for complex cases. The NHS has established AI labs and is actively piloting these technologies across multiple trusts. The potential productivity gains are enormous. Second, genomic medicine represents a revolution in personalized healthcare. Britain has sequenced more genomes than any other nation through the 100,000 Genomes Project, and we're now expanding towards millions. This data allows us to tailor treatments to individual patients' genetic profiles, making therapies more effective and reducing harmful side effects. For certain cancers and rare diseases, genomic medicine is already delivering dramatically better outcomes. The NHS is genuinely at the forefront of this technology globally. Third, remote monitoring and digital health tools could fundamentally reshape how we deliver care. During the pandemic, we saw a rapid acceleration of telemedicine and remote consultations. While these shouldn't replace face-to-face appointments entirely, they can dramatically reduce the burden for patients with chronic conditions who need regular monitoring. Wearable devices can now continuously track vital signs, alerting clinicians to concerning changes before emergencies occur. Patients can manage conditions at home that previously required hospital stays. This isn't just more convenient, it's genuinely better care in many cases. Fourth, preventative medicine and public health interventions offer the best return on investment. It's far cheaper to prevent disease than to treat it. Innovative programs targeting obesity, smoking, and alcohol consumption, alongside early screening programs for common cancers, could save both lives and billions of pounds. The NHS is increasingly focusing on prevention, with initiatives like the NHS Health Check program and expanded screening protocols. If we can shift more resources towards prevention while maintaining acute care, we could fundamentally change the demand equation. Fifth, we're seeing innovative workforce solutions. Physician assistants and nursing associates are expanding the clinical workforce more quickly than training traditional doctors and nurses alone. New apprenticeship schemes are creating pathways into healthcare for people who might not have considered them. International recruitment, whilst controversial, is bringing thousands of skilled healthcare workers to Britain. And there's growing recognition that we need to invest properly in retention, not just recruitment, with better working conditions and mental health support for staff. And sixth, the use of data and analytics could revolutionize how we allocate resources. The NHS generates vast amounts of data, but historically hasn't used it effectively. New analytics platforms can identify inefficiencies, predict demand surges, and optimize everything from operating theatre scheduling to ambulance deployment. Trusts that have embraced data-driven management are seeing measurable improvements in both efficiency and patient outcomes. And seventh, there's potential for innovative funding and partnership models. While the NHS should remain free at the point of use, there's room for creative thinking about how we fund and deliver services. Some trusts are experimenting with social prescribing, partnering with community organizations to address social determinants of health. Others are exploring outcome-based contracts with pharmaceutical companies, paying only when treatments deliver. And there's growing interest in how we might leverage private sector expertise and investment for infrastructure projects without compromising the core principles of the NHS. These innovations aren't theoretical, many are already being implemented and the results are promising. The question is whether we can scale them rapidly enough to outpace the growing pressures. So, where does this leave us? The rational answer is that both narratives are true. The NHS faces a genuine crisis, and simultaneously, we have access to innovations that could transform healthcare delivery. The crisis is real and demands immediate action. We need increased funding, yes, but funding alone won't solve the problem. Throwing money at inefficient systems simply creates expensive, inefficient systems. We need investment paired with reform, innovation coupled with accountability, and ambition balanced with pragmatism. The innovations are promising, but they're not magic solutions. Technology can improve efficiency and outcomes, but it requires substantial upfront investment, careful implementation, and cultural change within healthcare institutions. AI won't help if clinicians don't trust it, or if systems can't integrate it properly. Digital health tools are useless if patients lack internet access or digital literacy. Genomic medicine is expensive and won't benefit everyone equally.
The path forward requires several elements working in concert. We need sustainable long-term funding increases that at least match historical averages and account for demographic pressures. We need to invest heavily in preventative care and public health, even though the benefits take years to materialize. We need to embrace technological innovation whilst ensuring it's implemented thoughtfully with proper training and support. We need to address the workforce crisis through both improved working conditions and expanded training capacity. And crucially, we need cross-party political consensus that the NHS is above short-term political point scoring. Perhaps most importantly, we need to have an honest national conversation about what the NHS can realistically provide. The founding principle of comprehensive healthcare, free at the point of use, is sacred. But we must acknowledge that advances in medicine mean we can do far more than we could in 1948, and this costs money. We may need to have uncomfortable discussions about prioritization, about what treatments offer the best value, and about how we balance innovation with universal access. So, is the NHS facing crisis or innovation? The answer is both, and our future depends on how we navigate this contradiction. The NHS can survive and thrive, but not by continuing on the current trajectory. It requires bold decisions, sustained investment, genuine innovation, and a willingness to change established practices. It requires all of us, as citizens, to engage seriously with these challenges rather than treating the NHS as a political football. The National Health Service remains one of Britain's greatest achievements, a testament to the principle that healthcare is a human right, not a luxury for those who can afford it. That principle is worth fighting for. But fighting for it means confronting hard truths and embracing difficult changes. The future of the NHS isn't predetermined. It will be what we choose to make it. Let's choose wisely. Thank you for watching The Rational Brit. If you found this analysis helpful, please like, subscribe, and share your thoughts in the comments below. Until next time, stay rational.